So we're going to get into the lecture. Motor points were discovered by a French neurologist in the late 1800s, Duchenne de Boulogne. He put electrodes into cadavers and then live people, and he would make the muscles move. And he's really the first person to discover that our neurological system works on voltage. Up till then, they didn't realize that it was this chemical process that made a voltage change, and that's what would cause the muscles to contract. Trigger points and motor points are different. We'll talk about that, but it's always important to note that trigger points and motor points are not the same thing. Logical, and motor points are just a natural occurring area of everyone's muscle where the nerve attaches and there's a lower electrical resistance. I'll dive into that later in the lecture, but they're completely different. Everyone has motor points, and that's good. We all probably do have trigger points, and that's not so good. Okay. Some of the first motor point stimulation with acupuncture needles was done by this man, Dr. C. Chan Gun. He published his own book on the Gun method of treating chronic pain. And I'll go a little bit into some of his methodology, but at that time I think it was the late 60s, early 70s, it was, he did not want to be associated with acupuncture. He made some enemies in the world of acupuncture by some of the things he said at the time. And since then, he's kind of come back around and even written essays about the benefits of Chinese acupuncture outside of his intramuscular stimulation. But if you've heard of IMS or intramuscular stimulation, that's Dr. Gun's work. And he used acupuncture needles on motor points peripherally, and he always saw the root cause being along the spine. The points that we would call Wato Jiaji points, he would use with deep, thick needles to correct what he called spondylosis or pre-spondylitic conditions. So Dr. Gunn went on this theory, Cannon's law of denervation. I'll read a little bit of what it says. All denervated structures develop supersensitivity, including skeletal muscle, smooth muscle, spinal neurons, sympathetic ganglia, adrenal glands, sweat glands, and brain cells. Cannon and Rosenblatt's original work was based on total denervation or decentralization for supersensitivity to develop. Let's see, so I'll read the last part. But it's now known that physical interruption and total denervation are not necessary. Any circumstance that impedes the flow of motor impulses for a period of time can rob the effector organ of its excitatory input and cause disuse supersensitivity in that organ and in associated spinal reflexes. And what that's really saying in simple terms is if there's a slight compression of the nerve, it doesn't have to be a full compression, just slight pressure, then the nerve will have to, the nervous system will have to compensate by putting out more neurotransmitter, the acetylcholine, the neurotransmitter that needs to go out to the motor end plate to cause this cascade of chemicals to cause muscle contraction, will flood the tissue around the motor end plate and cause the muscle to be super sensitized. So that acetylcholine becomes an irritant to the muscle. And then it's more prone to contraction, spasm, muscle shortening, and eventually even trigger points. You'll see some of the theories of trigger points include that acetylcholine as an irritant to the muscle. So what he would see would be issues like tennis elbow, and he would treat the motor points for the tennis elbow, but then he would also want to treat the cervical levels that he believed were causing denervation. That was the cause of this muscle. Now, I don't follow a lot of the spinal theory because I work with more Vladimir Yanda's functional approach, and I find it very effective. But it's important to note that Dr. Si-Chan Gun was really one of the pioneers of what we do now with motor points and acupuncture. So I want to always give him the credit he's due, because he was doing this before anybody. And he really, I think, opened the doors to what we're doing now, even though a lot of his theories are not the theories that I believe work the best, which is more functional, which we're going to talk about. This is just from a little interview with Dr. Gunn. Can you describe for a layman your approach to study and treatment of pain? He says, the conventional wisdom has always been that pain is the body's signal pointing to a physical injury or inflammation. That can be true, of course, but most pain is different, and doctors have been mystified by pain, which is not related to any obvious injury. Because of this misunderstanding, for centuries, much treatment of pain has failed because doctors have tried to find the root causes in injuries that are just not there. Most chronic, persistent pain arises not from injury, but from subtle dysfunctions in the nervous system. I call it neuropathic pain. Almost invariably, nerves to muscles are involved. Affected muscles become shortened, and this physically compounds pain. And in a lot of ways, Yanda agrees with that. The doctors miss the point because they're looking at inflammation and they're not looking at dysfunction in the nervous system and muscle, and that muscle-nerve connection, which is what we're addressing with our electric stim and a motor point. And then, can you in fact cure pain? And Dr. Gunn says, yes, certainly. It's a joy that patients are so grateful. Of course, in reality, we treat the underlying pathology. If you can find the shortened muscles where the pain is located and relax them, and that's what we're doing with the motor point. I don't say relax, I say release, or we're resolving the contraction, but he's saying relax them, the pain will cease. I have developed a technique called intramuscular stimulation to stimulate the nerves within the muscles, that's the motor point. He's really making this simple for people to understand. But the nerves within the muscles, that's the motor point. X-rays and MRIs are of no help in diagnosis and assessment because a contracted muscle looks the same as a healthy one. But with training and skill, you can feel whether muscles are tight or not. I've also found that neuropathic pain has its own specific signs, and one can tell objectively when the pain is relieved. To stimulate the nerves in the muscles, that's the motor point, I use a very thin acupuncture needle. You can actually find the affected muscle cramp onto the needle, feel the affected muscle cramp onto the needle, and then it relaxes, and you've tapped the source of the pain. There are no drugs and no expensive equipment, so the treatment is very accessible and affordable. And I would disagree with nothing he said there. He was right on target and getting amazing results, published research, published case studies, and here we are today. Probably our medical doctors don't even know who Si-Chan Gun is. He's still alive, I think. I haven't heard that he passed. He's very old, but I believe he's still alive, and still completely, generally unrecognized by our medical school systems that should understand musculoskeletal pain, should be looking at what Dr. Gunn is doing, and instead we're just pumping people with opioids. So one day he will be appreciated. Dr. Janet Travell, you've heard of trigger points, those red books that Georgina has. If you don't have them, there's actually, they're very thick volumes. I think the newest one is maybe a little less thick, but combines the two, upper and lower. You'll see pain referral patterns in the slides that I've given you. The PDF that you got that's in color will represent the pain pattern a little bit better than the printout that you'll see. But I use a lot of myofascial pain referral in diagnosis because it leads me to what's injured, sometimes as fast or faster than just manual muscle testing. When I hear a pain referral pattern, I already have a sense of what's going on, and then I'll use the manual muscle testing to confirm my suspicion. Other people will just use manual muscle testing, figure out what's weak, and treat it, but how much better if you know both? So that's why I'm including myofascial pain referral, and in many cases, My experience with it was that you don't always need to treat the trigger points to make that pain referral go away. You just need to take the tension off of that tract of fascia and muscle, and then the pain will be diminished. And then if you still have pain after that, then you might have to track down trigger points. But high percentage of time, look at the pain pattern, figure out what's involved, treat the area, and you'll see fast results.